The University of Washington's Doctor of Physical Therapy program is the oldest one in the state of Washington.
There's a rich history here. All around the state, you'll find different graduates, and that goes for across the country.
We have a 97% board passage rate, and 100% of our graduates are employed after they pass the licensing exam. Our proximity to the University Medical Center is a real asset because it allows us access to patients who are on acute care floor without having to go across the country or even across the state.
The faculty and staff are amazing. I personally can't believe I get to come to work here every day.
All of our professors are very knowledgeable. Like I knew coming here, I knew that we had one of the best DPT programs in the nation, so like I kind of already had that expectation. And they've already, for the most part, exceeded my expectations for sure.
I learn best when I can take something out of a theoretical framework and apply it to real life, and the faculty really helped me do that.
Some of them are master clinicians, and they know how to work with patients, they know what to look for, they know what the clinical world is involved in because many of them still are working in the clinic.
They're not just up at the podium lecturing, they're there like helping you place your hands in the right positions. They're very engaged and it's a very active learning environment. The cohort here is about 48 people, which is really great because you get a diversity of people, but it ends up feeling very intimate and very small.
Our faculty to student ratio remains low. It's about 1 faculty member to 8 students. It's a lockstep program, so it allows students to first get the foundational knowledge that they need in their first year, and then during the second year, those courses are mostly clinically based.
There's really no substitute for working with real people that have real impairments. It created a space where we could actually see the importance of these things that we're learning in real life. And that was huge for me.
With that comes more experience, and I think for the student, increased confidence.
The faculty here is, they're doing premier research.
Because we have these really stellar researchers, it allows us to be on the cutting edge of what's happening in the physical therapy profession, and then to translate that for our students.
The research is very much woven into the curriculum in terms of like theory and the way that we're taught and instructed, but it's also really encouraged in terms of actual participation and like going into the lab or going into the field and actually getting that like hands-on experience.
We are actively working to increase the numbers of underrepresented students in our programs. And one mechanism that we put in place to do that is by having holistic admissions. We don't just look at test scores, we're also giving students the opportunity to tell us about the challenges that they've overcome and some of the hardships that they faced and how they overcame that.
And that's something that's really unique to this program, is that they really want whole people and interesting people that have had a diversity of experiences and backgrounds.
Within our realm, physical therapists, occupational therapists, speech therapists, just the whole therapy realm, I think there needs to be a lot more of all of us. And I think that, healthcare would improve, I think, greatly.
We really can make a huge impact on people's lives.
It's really nice to see the trend and seeing how they're probably going to go back and change a lot of people's lives, and to see the commitment of a lot of the students to go back and serve the communities that they come from.